Welcome to Cheskin Chats. My name is Whitney Kell, and I am excited to introduce to you Dr. Larry Cheskin. He is the founder of Johns Hopkins Weight Management Center with over 30 years of background in obesity. He's been involved in over 200 published peer-reviewed articles and clinical trials. Dr. Cheskin, it is an honor and a privilege to have you here with us today. Thank you.
It's my pleasure to be here. Thank you.
I'm going to introduce my mentor and coach as well. Certified coach Greg Rex is going to help interview Dr. Cheskin today to bring light to the opportunity of integrating weight and disease management programs into the practice of medicine. Greg Rex.
Thanks, Whitney, and thanks, Dr. Cheskin, for giving us your insight. And one of the big areas that I know we talked about in a previous interview was the lack of time that health professionals really have to address the challenges of weight and obesity. What are some things they can do to leverage the time they do have? What's the thing that they can have this amount of time and improve outcomes?
It's a very important question because we do have very limited time with patients, and there's increasing time spent charting that used to be a minimal part of our time. So what do you do? If you have 5 minutes, you can't spend 45 minutes talking about the person's diet and exercise. So take advantage of the auxiliary support that you may have right in your practice, or you can get outside your practice. So is there someone in the office who likes to talk to the patients while they're waiting for their appointment? Or a care provider who's an auxiliary care provider who's particularly interested in lifestyle change? Are they a good health coach? Are they interested in becoming formally a health coach? There are also health coaches available through outside means, and you can take advantage of that if it's not in your practice directly. And further, you can refer to the more traditional sources of help, to dietitians, to psychologists, and now we even have the ability to accomplish some things, maybe not as good as a face-to-face talk, but we can do group support, and we can also do apps that help people make their own changes and monitor themselves. So a lot of different possibilities.
Let's go a little deeper on that, the group meetings and the apps, because there becomes a social component to that. And I know there's been some studies that show that when people are making lifestyle change, having a coach, having their health professional, having a support group, those things can really make a difference. What are some things that you've seen that are effective when it comes to hosting events or meetings and gatherings? And then we can talk a little bit about technology as well.
I've had any number of patients say to me, I need accountability. And the goal is not to treat them like a child, that you need to be monitored and I'm going to be the parent. That's not a suitable model, except in rare cases if you really have a child who's a patient who needs that perhaps. But in fact, what everyone needs is some way to have follow-up and to have ongoing advice and support. And they may ask for it directly, or they may just appreciate it when it is provided. And again, you can't provide it terribly well in 5 minutes, but you can raise the subject and ask them if they would like additional support, and then connect them with that support.
Yeah. And there's been some studies that we've done in collaboration with Dr. Anderson that shows that there is a direct correlation with connecting with the coach, staying engaged, and then staying on this lifestyle routine. One of the things you also mentioned is technology. That's a great leverage tool. That's a great way to leverage. What are you seeing in that area as far as effectiveness and building some community?
I've done some studies in this area as well, and I can say I was pleasantly surprised that even what sounds like a fairly minimal intervention, sending people a text message that reminds them, of what kind of food they should eat and that they should walk more, can really magnify what you're able to do in the office. And we did a randomized controlled trial, which is kind of the gold standard, that you're comparing it to something else in a controlled fashion, and found that people lost more weight when they got some text messages that were geared to their particular situation and their needs.
So really it's about magnifying the impact of what little time you might have, is finding ways that you can stay connected, provide resources, and give people opportunities. Thank you so much, Dr. Cheskin. You know, we want to help every health professional. If they don't know how to do that, we have options to help them learn as well. So Whitney, back to you.
Thank you both, very much so, Dr. Cheskin, and very enlightening and great information. Thank you, Greg. If you have questions about becoming a coach, or you would like to see how you can connect with a coach, please contact the person who shared the video with you, and stay tuned for more Cheskin Chats. Thank you both.
See you next time.
Thank you.